So, sir, what actually involves nuclear medicine? Like, what does like, what we have to do in nuclear medicine if someone pursues nuclear medicine? What actually involves
Well,
in their life?
yeah, yeah, okay. The thing is that nuclear medicine has basically two arms. One is the diagnostic part. The other one is the therapeutic part of nuclear medicine. The diagnostic part of nuclear medicine can be thought like, can be sort of like radiology. Just to just for like common understanding, I will say that is uh, for diagnostic branch. It has basically two type of scans. One is the PET scan. The other one is the SPECT or the gamma camera scans. Gamma camera scans. So something is happening. What
Yes,
is
sir.
that?
I'm saying that I don't know how is it happening.
Okay, all right. Did I do something? I did not do anything. All right. That's great. Okay, whatever. The thing is that in our diagnostic part of nuclear medicine, we have PET scans and SPECT scans. So uh, there are like now the more popular one is the PET scans. You might have heard, which has like lot of applications in oncology, cancers, and even some applications in non-cancer uh, indications. So for staging any cancers, PET scan is the preferred modality, PET CT. So the thing is that before for this for for nuclear medicine, whether it's a diagnostic or the therapeutic part of it, actually it involves injecting a radionuclide, which is a radioactive substance, which is tagged with some other molecule. The most common one would be FDG, which might have heard, fluorodeoxyglucose. So when you inject a particular radioactive substance which is tagged with another molecule, the how it gets uh, uptaked into a specific cell, or how it gets attached to specific receptors in the body. So that's the logic behind how. So when it gets uptaken into a cell, or it gets like localized to a receptor in the body, like PSMA scan, right? So that's how the radiation which emits from that localized point will be captured by the scanner. So if you capture it in a scanner, you will get a scan. That is a diagnostic part of a branch. If you give something which can emit radiation and destroy that particular cell, it becomes the therapeutic part of our nuclear medicine. So when I say there are PET scans and SPECT scans, we use various radioactive substances for each. And for PET scans, there are as I said, the most common one would be the FDG PET CT. The other more special scans which are there are PSMA for prostate cancer, DOTA scans for neuroendocrine tumors. Then there are like newer tracers like FAPI, FAPI PET CT, like Extendin PET CT. There are lots. I'm not going into details, which is not needed. Then there are SPECT scans or gamma camera scans, which are like DMSA you might have heard, right? DMSA scan, DTPA scans, which are done for uh, kidney related issues to for GFR calculation for what drainage patterns, of course. Then there are bone scans which are done for bone like to assess metabolic bone diseases, then uh, bone metastasis. Then there are cardiac scans as well. There's a scan called myocardial perfusion imaging, which you can wherein you can assess the blood flow towards the heart. Then there is HIDA scan, that is hepatoimmunodiastatic scan, where that's basically a liver scan where you can study the functional aspect of the liver. Then actually there are lots of scans, but I'm trying to say that it's not like there are there is a lot of variety in the diagnostic part of our branch. So, and then comes the therapeutic part, wherein you might have heard of the radioiodine uh, ablation, right? In hyperthyroidism or thyroid carcinomas, you use iodine 131 as a tracer, and when you inject that, for
It emits,
there's a sorry,
it emits rays that 131
yeah,
and
exactly, yeah,
kills the thyroid
exactly,
follicles.
exactly. So when a specific iodine when a different iodine isotope is used, you can use it to scan the iodine, so scan the thyroid.
Correct.
When you use iodine 131, you can use it to destroy the follicular cells, right, and destroy the disease as part of it. And there are lutetium. Basically, whatever I'm saying is are radioisotopes. Basically, lutetium, yttrium, uh, yeah, actinium, terbium. There are lots, and so like it's an emerging branch, right? So there are lots of research going into what isotopes are better. So basically, the therapeutic part of nuclear medicine actually involves the treatment of thyroid carcinomas, hyperthyroidism, then uh, prostate cancers, PSMA, lutetium-based PSMA therapies. Then there are treatments for neuroendocrine tumors. So there are much more things which are under research, but these three, four cases are being done almost routinely now as part of nuclear medicine treatment. I don't know if I made it complicated, but basically there are two things. For the basic understanding, there's a diagnostic part where we do scans, and for the therapeutic part, we inject specific radioisotopes to destroy certain cancer cells. So that's the basic understanding.
It's a very
Did you
broad subject and very
actually?
exciting.
Yeah, exactly. That's why I took it.